It's really an exciting time to be treating patients with Parkinson's disease right now. We have a lot of new ways to take control of Parkinson's, a lot of new pharmaceuticals, and a greater understanding of the disease itself. So what we've been really moving towards currently is more treatments that control the fluctuations in therapy as patients progress with the disease, which becomes more and more difficult otherwise, and new treatments to control dyskinesias. Non-motor symptoms like psychosis now have FDA-approved treatments as well. There's always more work to be done, so I think we're getting closer and closer to having more continuous benefit with medications. There's a new approval for isradipylene, which is an A2A antagonist, which is a medication to help with dyskinesia, and a novel mechanism that we haven't had yet so far. There have been two other drugs in this class, one that failed and the other one had safety issues. So we're excited to see that we have a drug in that class that works, that's now approved, and another way to treat dyskinesia. We've had other recent approvals. Gocovri is a long-acting amantadine, and there's other controlled release amantadine products as well that also help with dyskinesia, so to have more medications in that space. And progressively we're getting towards more levodopa and other preparations that are more continuous. The big challenge in Parkinson's with levodopa really being the main therapy that most patients end up on to one degree or another is that it only has a 90-minute half-life in the bloodstream, so it really doesn't last very long. And even though early on patients can take it 5 or 6 hours apart, in advanced disease it lasts closer to 90 minutes. So we have all these bridging therapies to help rescue patients, to help get the medication to last longer. And then also there's other formulations now that we have, and more that are coming out with longer acting levodopa preparations as well.